It's time for our guest, Fusion Interview with DJ DLIFE. We're going to talk about anything and everything.
We're in lockdown.
We're locked down. Right. We're trying to make the best of it. Trying to make the best of it here. So how you been, man?
I've been doing all right. You know, the transformation is unreal. I keep telling people to wake me up. I'm dreaming, you know. It's just an unbelievable state of affairs. And, you know, just understanding the world on a whole. And now social distancing. You can't even kiss these days, DLIFE.
Well, I mean, it affecting us in all ways because, like you say, you know what I mean? Unless you're quarantined, not quarantined, you know what I mean? You're really you're on your own. You're on your own.
It is so real. It is so real. It's such a transformation. Maybe something is just telling us to slow down a little bit, you know? Maybe
Probably.
we need to and reflect upon our understanding of human beings and the way. And also it's important to understand that treatment options for what we're going through, COVID-19, depends not on any doctor or on any medical. It depends upon us, the people themselves, and how we treat and respect each other. And I guess that's what it's trying to teach us, because the only cure that we know so far is social distancing, you know, and that's important to understand. We need to do the proper hygiene, wash our hands, take off our clothes before we get home, stay away from each other. You know, the things that we were taught when we were younger, you know, growing up in the Caribbean, you get these little ethical things that your mom will tell you, wash before you eat, do all of these things. And those things are coming back and they're working very well.
Yeah.
Social
when you come in the house, don't go on the chair and don't go on the bed with your clothes from outside.
With your dirty clothes.
Dirty clothes.
You know, and it's amazing that those are the things that are working today with this COVID-19. It works like a charm, and we can see it all over the world. You know, from South Korea to Singapore, all the way down, social distancing is what's working. It's the only thing we have so far that is helping us to control this disease entity. And I think that it's important. Now, specifically for us in the Caribbean, we're lucky that most of the islands are surrounded by water.
Before you even touch that, Dr. Thwaities, let me formally introduce you so that we have this interview looking crazy.
Absolutely.
All right, so ladies and gentlemen, DLIFE, I'm here with you. I have the one, the only Dr. Dwayne Thwaities, who is a urologist from the beautiful island of Antigua, Barbuda. Right, he's one of the very few urologists that basically handles the whole Eastern Caribbean, and it's an honor and a privilege to have him here. He's also a very good friend of mine, and he's responsible for a lot of major events. We're going to get into all of that, which is one of the most commemorative, the Big Breakfast Fete in Antigua, which we just heard Antigua Carnival has been canceled. So, with that being said, ladies and gentlemen, Dr. Thwaities.
I like the way how we started off this, and I like how this is good,
and I leave it, and trust me, I leave in all of that in because I want people to get the real aspect of it. You know, I mean, this is not no formal thing. This is two friends here talking about, you know, from a professional standpoint, what it is. From a doctor's standpoint, what folks need to do, and you know, but a lot of people watching, you know, what it is they could do in order to deal with it, because it's not the same as dealing with it here in the U.S. as it is dealing with it in the Caribbean.
Absolutely, and that is so correct, and that's one of the things that we've been preaching. And what we note is that the spread of the disease, again, it's a little bit different in the Caribbean. And some of the doctors and some of the scientists thinks it's because of the warm weather, why it doesn't spread as quickly and it's not as dangerous. That is what we're seeing from the data that we're collecting between the Eastern Caribbean, that it doesn't, we're seeing more of the milder form, and we're seeing more people who maybe asymptomatic who might be spreading the disease more so than we're seeing the aggressive forms that we see in the other countries, which have a little cooler temperature. Some of the scientists feels it's the weather, and I think that, and they're talking about as it gets warmer, we might see the decrease in spread. This is something we have to look at. I think that because it's so warm, that the length of time, which is what is important about the coronavirus, COVID-19, is the ability for that that organism to stay on different fabrics, different materials for an extended period of time. I do believe that in the Caribbean, because it's a little warmer, that effect is not as great as it is in some of the colder countries.
Right.
And so therefore the spread is a little bit more limited for most of the places in the Caribbean at itself. And I was touching a little bit on the fact that we are already, they talk about isolation as one of the cure for the disease. And as an island in itself, surrounded by water, the number one thing, we are isolated at this point in time. So if we do what they suggest that we do, all the hygiene, all the cleaning, all the isolation and everything, and then we do good contact tracing, the limited amount of disease that we have on the island should be able to be curtailed once we lock down, contact trace, isolate, and even if we have to quarantine the people that are in contact, then that way the disease should disappear, and then we should look forward towards opening up once we have this under control. But one of the things, DLIFE, is that we need to have enough testing to figure out who have the disease. Are they spreading the disease? Are they asymptomatic carriers? Are they have mild form of the disease? Again, looking at the data between most of the islands that I've worked between Tortola, St. Kitts, Nevis, Antigua, that we are seeing that the disease is very limited, very short acting. We're seeing more and more of the fact that we have asymptomatic people who might be carrying the disease, and the fact that most of our patients are not going on the ventilators. It tells us that the disease is not as aggressive, or that we're doing the right things in terms of social distancing, that we don't get the disease to become so severe where we have to intubate and put people on ventilators.
Okay, so let me ask you a question, Dr. Thwaities. Now, in regards to Antigua, how many confirmed cases are there in Antigua at present?
Right now we have 23 confirmed cases, and we have 3 persons who have fully recovered. That is, after they got tested, we tested them again, and their test is coming back negative. Now, bear in mind that we're using the PCR testing with the swab and the saliva and bronchial lavage. Those are the ones that we're using, and we send all our results over to CAFA. And CAFA then will tell us for sure if these people are tested.
And where is
so
CAFA?
far we have 23. CAFA is based in Trinidad.
Okay.
And that's it's a Caribbean research group which are doing all the testing for us.
Okay,
and,
so there's no actual, you guys take the test and then you have to ship it out, send it out. So now is there, and I'm just trying to be, for the average listener here now, what is the time period from it leaving Antigua, getting to Trinidad, and you guys getting back the results?
Yeah, we get the results back in 3 days.
3
days, that's what we'll be doing. But bear in mind also that PAHO has just come into Antigua a couple of weeks ago, and they have trained, and we're establishing a lab in our hospital facility that should be able to do the testing for us at this point in time. But all of that is in progress right now. Hopefully between this week and next week, we can do our own testing.
Okay, that is great news. That is great news. Now, as far as Antigua, you stated that Antigua is an island, so there is travel restrictions now. There's nobody coming into Antigua.
Yeah, we have completely locked down the borders, just like what most of the other countries have done. They've locked down their borders, and so which is very useful in terms of fighting the disease. Then we can focus on what we have on island and try and get to those people. Again, that's where contact tracing comes in, comes important, that we can find who have been exposed, put them there, isolate them, wait your 14-day period, and then try to assimilate them back into society once we know they are negative for the disease or they're not presenting with any symptomatology.
Now, this is one of the questions I had, Dr. Thwaites, where they said now there's a new study that came out now, and they say after the 14 days, folks are still susceptible to be contagious. So what is being done in terms of that now? How long do you keep them after the 14 days? And is it possible for them to actually test positive still after 14 days?
And that is such a great question. When we look at the data coming out of South Korea and some of it coming out of China, Wuhan, because of the fact that they're now opening back up, what they've seen that there is 161 persons who in South Korea, after tested negative, and now come back tested positive. Now, the pundits out there are saying, well, probably there are still viral particles that have resurged or come back around. It's not really the full disease that these people are showing. What we're doing presently to help us understand that is studying those people and see if they can actually spread the disease. Now, few of the doctors coming out of the US, and one of them I actually have read about from out of New York City, have said once you have had the disease, then more than likely you have developed an immune resistance, and then if you have recovered, then you won't be able to spread it. But right now, we're still trying to understand if these people who have the resurgence of the disease, if they are still infectious. Again, we're watching. And that's a very confusing point and a very great question, because then we need to know how are we going to come back out? Because if perhaps that someone has recovered and now all of a sudden they have the disease, and now are they spreading it? How are we going to get back to open up our borders, open up if this is occurring? And so we're still looking at some of the data. We're looking at the people in South Korea and there. But as far as the research is showing, they're not really spreading the disease, but they have some active particles, not active, but they have particles remnant of the disease in their system. And we're still looking to see if those people can still spread the disease. So that's a very important question. The answer to that is that we really don't know as yet, but we're still looking more and more to see what is going on. We know that most people develop an immunity once they get the disease, and some of the studies coming out of China are saying that even if you get the disease again, you are able to fight it off. It's not as effective again the second time around. That's what some of the data is showing. So it's a very good question. The answer is we're still watching and we're still looking and we're still trying to learn.
Very good. So, and I just want folks to understand that too, because I think there's a lot of confusion with people where they think after the 14 days, I am good. I could go back out. I could just go back out into society, and I'm fine. I don't have no more symptoms. I'm good. I'll go back and mix with people, and these people are going back out there, and there's some data that is coming back and showing that they are contagious.
Yeah, actually, in your hometown, there were I think 8 people who had come back off of the cruise had tested negative, and then when they retested them back in Trinidad, they came back to be positive. So again, we're looking at them. It doesn't seem like they're reinfecting people, but we still got to watch the data. And bear in mind also, DLIFE, that there are some people who you have to test it all up until 24, 25 days out. They still are coming back positive for the disease entity. And so we have to be very careful when we say you come back out. That's why testing is so important, and retesting is going to be so important to all of us. And that's so important.
Very good. And now let me ask you something, Dr. Joy. Is there's no shortage of testing in Antigua?
No, absolutely. There is shortage of testing all over the world. They are trying to get everything together. And then the type of testing is becoming a big question, whether the antibody testing is effective or not. Again, what we're doing, we're trying to work with the gold standard, which is the PCR test, which is the one that tests for viral particles within the saliva, within the bronchial lavage and around. We're looking at that presently as a gold standard, but people are still doing researches on the antibody testing. And the antibody testing is supposed to tell you whether or not you have active disease versus non-active disease. And those tests are still being researched and are still looking. That's the serology testing. And that's important to understand that we don't have a good handle on that presently, but we have a good handle on the PCR testing, which tells us that the viral load, how much virus you have within the saliva, and that test for us is what we're using presently to do. So we don't have enough testing going on, I'm being straight up and honest, but we're going to try and get to that number at some point in time. And I think most of the islands are doing so. In some other places, like for instance, in Tortola, they do the test for CARFA, but they have private testing that are done. Those private testing that are done done as preliminary tests. And it says to you, look, you look like you might have the disease. And then what they do is draw a second set of testing and send it to CARFA, and that confirms the test. And that way we keep everything well documented and we keep our numbers good. If you note, most of the numbers that are coming out, they were stating that it's coming out of Johns Hopkins. One area is really collecting and putting all the data together so we can better understand the disease itself.
Now, is between the two tests, now these tests are they free? Folks can get these tests for free?
Well, the one from CARFA is done mostly by the government. It's free. The private labs, I think, do charge to get these testing done, as far as I know. Now, these are places that I know between St. Kitts and Tortola where people are doing some private testing, and then they do those preliminary results. So those you have to pay for. Now, in South Korea, what they were doing there when they were testing everybody, they will test everybody, but if your test is positive, then the government pays for it. If it's negative, you have to pay for it. So those are some of the things that are going on internationally.
Right. Now, in terms of masks, now, I want to get your opinion now as a physician in terms of the mask, because you have mixed views with it. I mean, here in the US, we have a man in charge that that has his own views that is very confusing. It's causing a lot of hysteria here in the US. It's actually causing people to, he basically incited folks to go out and protest. You know what I mean? I just don't get it. But give me your opinion in terms of wearing a mask as to not wearing a mask.
Well, DLIFE, it's simple and it's straightforward. I'm an advocate for masks. And the reason I'm an advocate for masks is because me and you, and we could walk through this simply and easily. The disease is spread by droplets, by coughing, by sneezing, and by when you cough or sneeze or put your hand in your mouth, it goes on your hand and you transfer it to certain areas. So if that's the major mode of transference for the disease, so we need now have to get something that protects us from getting these fomites or from getting the particles out to where it's going. In all essence, it tells you that if and we're going from one person, if you are an infected person and you want to prevent the disease from getting out, you should wear something that covers the source of the infection. So you should wear a mask. You should wash your hands because you don't want to do anything, because if you sneeze or what, it gets to your hand. So if you wash your hand, you desanitize and everything. And you should try and protect your eyes from the disease from getting into the mucous membranes of the eyes, the lacrimal glands and ducts, because that's where it gets in, and it gets down into the back of your throat and go down. Those areas, we know for a fact the disease, like the virus loves those mucosas of the airway, the mouth, and more so it loves the lungs. The lungs is it's big stuff.
Right.
There are certain receptors in those areas that the virus attaches to, and it's able to unload its nuclear, the RNA into those cells and then multiply and replicate, and then it does its destruction. So they were what we call a ACE2, angiotensin converting enzyme 2, which are in the lungs, and it's also in your GI tract. Actually, coronavirus is known to cause you GI symptoms, the diarrhea. So these are some of the things. So in order to prevent DLIFE, the virus from spreading, a mask is necessary. It's absolutely not, especially if you are carrying the disease. So mask, wash your hands, protect your eyes. On the converse, if you are a person who is going to be taking care of somebody who has the virus, one, you should put on a mask. Two, because one, it protects you from getting anything from that person into your body. So that's important that you do so and you protect yourself. So in taking care of that individual, you should wear a mask. Now, we also know out in the society, people can transmit the disease and not knowing they have the disease.
Right.
So therefore, you should also put on a mask on the other, because you really don't know who has the disease, who is carrying the disease and asymptomatic. And the second thing that's important to you as a person on the outside is that when you touch something that person, you want to be sure that you should wash your hands and that you don't take that same hand and put it on your face. So if you have a mask on, more than likely, you're not gonna put it on your face or around, or if you have a shield over your eyes, you won't put it in your eyes. So it's therefore important that you protect yourself from getting the disease by putting on the mask. Therefore, you don't put your hands in the face. Now, when we look at the data coming out of places the way it works, like South Korea had recommended, anytime you're going in public, you put on your mask. And that is how they control the disease. You don't know who has the disease. So if you have on your mask, not that it gives you a sense of security, but you are already protecting yourself. Two, if you have the disease and you don't know you have the disease, you're not spreading it to somebody. So with all those things in mind, what does that tell you, DLIFE? What's the answer to your question?
The mask is essential.
It is very essential that everybody put on their mask when they are in contact with someone or in any public areas, and you wash your hands as much as possible in public areas. That is so important. So everyone, if you're in a public area, should wear the mask. If you're in the car by yourself, no. But in New York City, you're in the train, you're in the subway, wherever you're going, you should really be putting on your mask because you are in public. Remember, most importantly, DLIFE is that you don't know who has the disease. So if you're putting on your mask, you are there protecting yourself. Second most important thing, you might touch something that have the disease on it and you can't put it to your mouth because you have your mask on. So that protects you. And then I go back again to the basic ethics that your mom teach you back in Trinidad when you're running around. When you reach home, take off your clothes, drop them by the door, and go inside, take one shower, and come by the table. Make sure your hands washed and say your prayers.
And what's your
all them things help out,
right? Now, what's your take? What's your take, doctor, in terms of, because a lot of folks don't have masks to say they could change every day or every time they go outside. What's your take on people reusing masks, and is that recommended?
Absolutely. Again, what's the safest thing you can do is put on your mask.
Right.
If your mask is dirty, you can lysolize it. Some people steam them. Some people do a lot of different things to protect them. Even if you don't have a mask, it's recommended that you use some kind of cloth or something and put it over. Again, for the simple reason,
right.
Put it around, because you don't want nothing coming in. And if you have it, you don't want nothing going out. And these things, even if it might not 100% protect you, DLIFE, it gives you some form of protection, which is what you want. That little bit of extra edge that you need is what might save your life. And so it's important to understand. I tell people all the time, you're either 6 feet apart, social distancing or 6 feet under. It's your choice, my boss. You decide on that. 6 feet apart or 6 feet under. You need to understand those principles.
And that
the
is
only
pretty...
thing that the only thing that works is social. The only thing that works is social distance. The only treatment we have is social distance. And that social distancing depends on we, the people. It's the only disease right now that the treatment is us. The people
and I'm glad that you mentioned that, because that leads me to my next question. You're seeing online a lot of these so-called remedies. Apart from the drugs that they are testing, these so-called homemade remedies, like folks are talking about keeping your head, which is something we used to do in the Caribbean. Yeah. You keep your head over a steaming pot with ginger and orange peel and all these things, and you inhale the vapors. Now, folks are saying that this is effective. You're hearing a lot of testimonies online with folks coming on and saying they had the virus and they weren't feeling well, and they did this, and they coming out feeling brand new. Is this something from your professional standpoint? Do you recommend folks trying this?
Well, again, DLIFE, and it's very simple, very straightforward, and understanding the organism that is spreading the disease. An obligate intracellular organism, it needs a host in order for it to survive.
Correct.
Viruses on a whole, they don't like heat. They desiccate and they disappear. So I am not the one to tell you that the garlic and the onion peels or whatever don't work. I really can't I have not tested it against that. But this is what I know works, which is what I've been saying to you all along from the beginning. Heat works. So therefore, if you put your head over these heated stuff, the garlic, onion peel, and you inhale that, it gets inside. And what it does, the heat destroys the virus. So once you inhale that heat and then put it back out, it should help you in some way relieve yourself of some of the disease. The other thing, which is important, the problem with the disease is mucus plug inside the lungs, and that's where the respiratory symptoms come in. If you inhale some garlic and some onion and thyme, that's going to give you some irritation and cause you to cough, and then you get the junk of the disease back out. So the heat is important. The irritation from whatever you're inhaling can help you. I am not telling you that the garlic or the onion peel or whatever, but I know the few things within that regimen that can assist you in preventing the disease. One of the things that we do know is that they were using albuterol inhalers in the emergency room in New York City. And the way how that worked is that when they give you those puffs, it gets into your lungs, just like the inhaling heat and whatever, and it gets into your lungs and it causes you to cough, and it dilates the bronchioles, and all the virus flushes out, comes out of your lungs. And that is important to understand. Now, if you're in the room, you will be able to pick up the disease, which is the same thing. When you do inhale all these fumes and everything from your garlic and your onion peel, and it's hot, it gets in and it breaks down a couple of the mucus plugs and it comes right back out. So you also have to be careful of the people inside the area where you are, that you don't push it out to them. And again, that's where your mask comes in, and that's where the people around you should get. So some of these things can effectively help you. And again, our Caribbean people, they talk about fever grass, fever grass?
Yeah.
And understanding, to be honest with you, I've been drinking some hot teas. I drink all like 6 glasses of hot tea, because I understand that if I have the heat inside of me, that virus not going nowhere. You're going to run. It's going to disappear. Heat really does kill the virus.
That's very good to know. And I like that coming from you. So I know after this, a lot of people are going to be baking tea. A lot of people are going to be,
Look, we know. It is one of the remedies in China. These were some of the things they were doing. They were drinking a lot of tea. They knew the heat was helping them, and they knew, well, that was what they need to do. Remember, the coronavirus, influenza virus, all of these things predominantly occur during the winter months when it's cold. These viruses love them kind of cold weather. And then when it gets into the warmer months, these kind of viruses, they disappear for a while and then they come back during the fall months again and again. So this is what we see. The virus on a whole is really very similar to MERS and SARS in its genetic makeup. There are maybe about 4, I think they said there were 4 nucleotide difference between the different ones that we see between SARS and MERS. So they're very similar. Again, this is why most of those countries were prepared for this. In 2002, they had SARS in China. And then right after that, in 2014, MERS developed. And then right after that, we had the swine flu. So most of these countries were seeing these changes in the virus occurring. And this is the coronavirus. And so they were very well prepared for this because they knew something was going to happen. They were ready to jump at this. And so with the isolation and the strict social distances, they were able to control it. We're now looking at how we're coming back out. We're looking at medications which might be able to help us control this disease. And of course, most people are waiting for the vaccination to come.
And let me ask you something about this so-called vaccination. In your professional opinion, when do you foresee them having a vaccine?
And that's a great question. Again, when we look scientifically, for us to get a proper and good vaccine, most of the scientists will tell you it's going to take about 18 months. Now, saying that to say, we were able to isolate the virus causing the disease within a month. 1 month, they were able to say, this virus cause a disease, which is something unheard of in history. They weren't able to pick up this disease so quickly, but we did. And that's why we should have been way ahead of this disease instead of being behind at this point in time, because we picked it up early, we were notified, and then I know there's all this conspiracy theory going around, which, you know, from a scientific perspective, I really can't answer some of these questions, but it was picked up early. So I am saying that with the ability that we have in this day and age, you understand, you can zoom me all the way from Antigua. We should be able to get something in a quicker time. I'm hopeful that it might be better. I know for a fact, probably within the next month or 2, we should have some medication which is going to be helping us treat the disease. Okay. And that's for real. It looks possible. Some of the data that is coming out of there, the New England Journal of Medicine had just published one with remdesivir, and it looks like it's working. We're hopeful. There were 2 double-blind placebo studies done in China, started on February 5th. They're hopeful that in the next 2 weeks, by the end of the month, we should have some answers to that. And there are about 19 studies when the last time I checked going on with different medications, which we're looking for results within the next couple of weeks to a month. So hopefully, if we get to that point where we can start treating the disease, prophylaxis, to take medication and all that stuff, then we should be in good stead. Hopefully, and we just got to pray. The curve look like it's coming down in New York City. Social distances is working, regardless of what.
We still have some folks doing real stupidness. I mean,
yes.
we have a lot of protests actually started this weekend here, with folks actually listening to this guy.
Virginia, Michigan, and somewhere else.
And Pennsylvania and
Nevada,
so-called red states. People coming out and protesting and coming out with their kids too. I'm watching some of the footage and I'm like, you know, it's just scary to see that even with all the media and all the publications and all the scientific backings, people are still coming out and being so naive about this thing and still coming out and still mixing with people and acting like if it's not as serious as it is.
In Trinidad, they call it murder.
Now, let me ask you something. Let me ask you something now. In terms of opening back up, and I would take you up in terms of Antigua. When do you think it would be safe I wouldn't say outright 100%, but when you think it would be okay to open back up the borders, let's say for Antigua.
The borders. Right now, I don't know so much about the borders. What we need to look at is how are we going to open back up the city? And again, as I say, and I think that is what even your governor is saying, we got to test it out in small portions, little bit by little. You got to look at your data. How is it spreading? Is it really, do we have all the contact tracing done that we know where everybody is, where they are with the disease and what we do? So we can say these people can come out and that come out. I do think that looking at the data from Antigua itself, we still need a little bit more time before we come out, but we can start testing the borders. We can start testing coming out in a small amount, because for us, in Antigua itself, the government had allowed the supermarkets and the banks to open on certain occasions. And we had an influx of people and the people coming down. And when we look at the disease, you would have expected a rise in the disease. We're not seeing that. We're actually seeing better control. So I am hopeful that if we continue to watch and see where the disease is going, that within a couple of weeks or so, we might be able to open up a little bit more. Now, for international travel, I have said to everybody, this is how we're going to do international travel. You need 2 documents if you want to fly in, boss. You need a passport and a COVID certificate if you're going to come back in. We got to know, because we're already locked down and we
already have it on control there.
Yeah, correct. So we need to know when you're coming in, you have a COVID certificate within the last 7 days that say you're COVID free. So you come in with 2 documents. And before they even try to get you on the plane, the person at the agent at the desk should have that documented and it's well certified. Just like your birth certificate is certified. This COVID certificate got to be certified, my brother. And now, then you can come.
Do you recommend now, even with that certification, because you never know who somebody could get in contact with within that?
That's what I'm.
Right? So within that now, let's say now the person comes in, do you recommend quarantine in visitors now for a period of time? I mean,
why you asking me that question, boss? So unless you're coming for a month, we're going to quarantine you for 2, and then you're going to come online for another 2, because it's kind of hard to bring you in. This is why I say a well-certified COVID test that says that you are. And when you land, our physicians or whoever is there is going to look at it and document it. Just like how you have immigration, we're going to have immigration, customs, and our health department right there waiting for you. You come in, we look at it, and we see what kind of test you have. And we make sure, and we test you again. We do a little temperature check. I don't think that if within the last 7 days or so you have that COVID test which shows you're negative, that you should have any problem coming back in. Again, I might be a little bit naive, but I think that those are the things that we have to start looking at, or else our tourism is going to go downhill. We have no money coming, and you can't go play no mass, boss. We're locked down. You understand? So we need to do something. Something got to happen.
Right. And I know you have been, you spoke to the government officials, and I know they take your word very seriously because you're well respected. So I wouldn't be surprised if that whole COVID passport come into play. Then I could know. I don't know where it comes from.
You absolutely know. We need a COVID certificate if you're coming here, boss. Don't forget to work with that.
I'm here with Dr. Dwayne Thwaities, leading urologist in Antigua, Barbuda. Now, on the festive side now, we get through that formality. I know you're a man responsible to your breakfast fete. And a lot of people, let me paint the picture. This breakfast fete is over 29 years in existence, ladies and gentlemen. This is not no fly by the night event. This is a signature event for Antigua Carnival that has been going on for the past 29 years. And for the folks in Trinidad and around the thing, if you haven't heard about this fete, you know about Veil. Now this fete is basically is right behind Veil in the amount of years. And your event is so huge. I mean, I witnessed it for the first time for myself last year, and I was totally impressed. I mean, we have this whole docu-series coming out on it, right? It is an event where folks basically, you come and you drink for free, and you have entertainment from the young, from the old, from the I wouldn't say old. Let me correct myself. From the veteran artists and all the way up until the new artists on them, and it's an event that starts from like 4 a.m. in the morning and goes until like 7 p.m. at night. I mean, I know it's basically canceled for 2020, just like a whole lot of other things. Basically, the whole of 2020 canceled. But what is your view on it, and what could folks look forward to for 2021?
Well, I mean, DLIFE, I don't even know what's going to happen now for 2020. I have not called off my fetters yet.
Really?
I am still looking. Yeah, I am still hopeful that that things might turn around. I'm keeping my fingers crossed. Again, I mean, we've been doing this for 20, 28, 29 years now. Mm-hmm. And it gets together and it comes together without much of any, what would I say, intricacies. And so therefore, if by say July, they tell me that social distancing you can still do and we're opening up and you could show a fete, I am still willing to do this. Again, it's also emancipation for Antigua and Barbuda. It's the celebration of the freedom of the slaves, and that's on the Juve morning Monday. So it's still something that we could still put together. What I've said to most people who have asked me a question, we're doing a costume party this year. We're wearing masks, gloves, and we're gonna have sanitizer, and we're going to party. If it's all that we get to where we're going and everything opens back up and they say, look, you can do something, I am willing to still go ahead and do so. I think that at that point in time, DLIFE, we're gonna need some kind of relief. And that's what we're offering, relief. And so I am saying to you, we still have the possibility of doing the breakfast fete. And I'm still looking forward to see what we can do with to look at the science of everything and being hopeful. We're looking at August 2nd, if for anything. And if it doesn't happen, it doesn't happen. You understand? So right. That's what I'm looking at.
Well, I mean,
so it's a possibility.
It's a possibility. Well, we here with you.
Yeah.
I don't know how much, you know, I mean, I hear, you know, I'm one of your hosts for the event. I don't know if they will allow me to travel. You know,
what I'm saying, let's suppose we still have a couple of months to go, DLIFE. Suppose right. Things open up. I remember one of our partners you're supposed to bring for me. I'm hoping that they will show up. If it opens up and you have your COVID certificate, who just say we can't?
Right?
We're gonna need. Trust me, we're gonna need something by August, and I think that this might be the outlet for everybody. Costume party, the breakfast fete, the costume party. Put on your mask, put on your gloves. You know what I mean? And walk with your sanitizer. And we're going to do what we got to do.
Ladies and gentlemen,
we're hopeful. We're hopeful.
Yeah. I mean, and I think it's something where if folks do what needs to be done now, we'll be able to have fun later.
No, and that is so true. And that's the important aspect. And people are going to want to have fun later. So let me just see what happens. I know the flight's going to be cheaper. Get your certificate and get ready to come. All right, my brother.
Yes, sir. Well, ladies and gentlemen, Dr. Thwaities, I thank you for taking time out of your busy schedule because I know you're out there on the front lines dealing with this. And I just want to tell you, stay safe, my brother. Keep safe. Blessings to you and the family. And we definitely appreciate all that you're doing.
My brother, you stay safe too. And remember, 6 feet apart or 6 feet under. You take your choice.
Yes, sir.
All the best.
Thank you. All right, doctor. All right, Dwayne.
DLIFE.
DLIFE.
Life for life. DLIFE. Saving lives.
Yes, sir.
All right.